Hello, I'm Dr. Russell Libby, and welcome to the world of medicine. As you know on this show, we talk about important topics and conditions in medicine. And we learn about them through the experiences, through the actual real-life experiences of people like you and me, our studio audience. We're going to learn about vision today. We're going to learn about the kinds of things that can affect your vision, that can take your vision as you age or with certain types of diseases. You may have heard of some. Diabetes has an eye problem called diabetic retinopathy. You have macular degeneration. You have things like retinitis pigmentosa, glaucoma, cataracts, a number of things that you've heard about. You may know people who've suffered through and have had to deal with vision problems because of these. We're going to learn about how they evolve and what happens to these people from them. We also have our experts here. We have Dr. Michael Rivers. He's an ophthalmologist, a doctor who is actually a retinal surgeon. He's a specialist taking care of age-related macular degeneration. He is with the Retina Group of Washington. We have Dr. Suleiman Alabai, who is a doctor of optometry. He is a doctor who actually helps to identify what kind of visual problem you have and how you can use corrective and other kinds of interventions to actually improve your vision so you can get the most out of what you have. And he's also bought Terry Gwynn, who is an occupational therapist who actually helps those people who have vision problems learn how to live in their environment, helps them find ways to cope with the interruption or the imposition that their visual difficulties may have on their daily activities. So we've got a great audience here. I'm really appreciative that you could come. I guess the first question I have for you is, which of you actually would be considered legally blind? I want to see a raise of hands here. That's a fair number of you. I know that we have also some spouses and other caregivers. We even have a real canine caregiver here. He's not here as a patient, but as an assistant to one of these folks. But I want to know just basically what it is that actually did cause your vision loss, if you know what that might be.
I have no idea what it might be, but what I have is referred to as age-related macular degeneration, and I don't like that term because I'm only 90 and I really don't like it.
And I can imagine, you know, it's one thing when you hit that 100 mark, and we'll come back and ask you about it then.
Hi, I have myopic degeneration.
Myopic degeneration.
Retinitis pigmentosa, better known as RP.
RP, all right. And then we have also back here.
Hi, my vision is affected by diabetes.
Diabetes, so we have diabetes to talk about.
I have CNV, which is, I don't know if I can pronounce it correctly, cordial neovascularization and histoplasmosis.
Histoplasmosis, so that's a good one. We're going to hear a little bit about that too.
I also have retinitis pigmentosa.
Okay, retinitis pigmentosa again. It's an interesting condition we're going to hear about a lot because we really want to know what it does to your vision.
Macular degeneration.
Macular degeneration, a good topic as well.
Retinoschisis.
Retinoschisis, and that's a term that isn't very commonly known.
It's not very common, no.
Okay, we're going to hear about that too.
I have a choroidal neovascularization.
Choroidal neovascularization, okay.
Retinitis pigmentosa.
Okay, so we have a good representation there. And here we are.
I have chloroquine toxicity. I was on medication, became toxic, and scarring around the optic disc. I have central vision loss.
So there are medicines out there that people take that can affect their vision, and I take it wasn't something you expected.
No.
I have retinitis pigmentosa also,
Okay.
and I have a severe hearing loss with it. I wear 2 aids.
So that's something that can be associated with it. Interesting. Okay, we're going to hear a little bit about that too. And I know
I'm her spouse.
you're her spouse. Well, fortunately, you've got a good-looking caregiver here.
I have diabetic retinopathy.
Diabetic retinopathy. Okay, we're going to hear a little bit about that because diabetes is a very common disease in our country, and it's remarkable what percentage of people with diabetes do have changes with their eyes that could be very significant. Very remarkable. Yes.
I've had multiple retina detachments in both eyes.
Okay, and were those caused by trauma? Do you have any idea?
No trauma. It's still a little bit of a mystery. I did have hypertension for a number of years, but nothing out of control. And each retina detachment was followed by a massive scar tissue that caused another retina detachment. So there was a
No, so
problem.
that's a pretty complicated situation.
I have retinitis pigmentosa also.
Retinitis pigmentosa. Very good. All right. Well, I think a great place to start, just to have a sense of what goes on with vision, is to pretty much get a description as to how the eye works from Dr. Rivers.
I'd be happy to show you that. I've brought a couple of models here today, and I'd like to start with the larger poster here and just show that the eye is a camera. The eye has lenses in the front. The first lens is called the cornea. The second lens is called the natural lens. And those lenses focus light in the normal situation against the back wall of the eye. The retina is the film in the camera. And the retina itself is actually brain tissue, which is one of the reasons it's so difficult to fix certain retinal problems. The brain is nervous tissue that does not regenerate, so we have to work with everything that's there. This retina lays against the back of the eye and converts the light to electricity, and in the normal situation, that electricity goes down the optic nerve to the brain so that we see. Another aspect of this eye that I'd like to show you is the cavity where the inside of the eye is filled with a jelly that's called the vitreous. And the vitreous has a consequence in patients with diabetes and patients with more complex retinal detachments, like the gentleman here.
Okay. Well, I had to come over and hold it up because we were getting a little bit of a glare there.
Okay.
And I didn't want to have that happen. In terms of the kinds of conditions that people most commonly see, we've heard about diabetes. And I guess I would like to know a little bit about your diabetes and how it evolved. I mean, let's say, were you what they call a type 1 diabetic or type 2?
I'm type 2, but
Type
it's
2.
genetic because my parents were both diabetics.
Okay, so you had fairly normal vision for a long time?
Yes.
And how long were you a type 2 diabetic when you started to have some changes with your vision?
Probably 15 years. I first saw the ophthalmologist in 1996 and had some laser treatment in my left eye at that time. And
what
then a
was
few
going
years
on at that
later,
point? What kind of symptoms were you having? I mean,
I was just losing sense of seeing, some dulling.
okay, so dulling was a symptom you had?
Yes.
Okay, and it lasted for a while. You then got that taken care of. Did that help? Did the laser help?
It did, yes.
Yes. Okay, so dulling, that's a symptom. Dr. Rivers, tell us a little bit about some of the symptoms we're going to hear about and what might be the cause of those symptoms.
Many people will notice difficulty in common tasks, so that people will have problems with reading. They'll have problems where things are not so bright or more dull. They'll have problems with driving. They'll have problems with being able to see faces. And these are all very common problems for some of these different ocular problems.
Okay, and you had mentioned you had diabetes as well? Was that?
Uh,
Oh, you had
macular-
macular degeneration. We had some diabetes here somewhere. Over here, that's right. Okay, I'm sorry. I'll get it straight. So, were you type 1, type 2?
I'm type 1,
Type 1. So, you became diabetic at about what age?
12.
The age of 12, okay. And at what point in your life did you start to have problems with vision?
I was about 46 or 47. 46, I think.
So that's a pretty reasonable stretch of time for diabetics, I suppose. Tell me, what were the symptoms you had early on?
Oh, I had, it looked like black ink had been squirted into my field of vision. Just, I could see it bleed. I could actually see a stream of blood. But at the time I didn't really know what it would look like. And it's black when it's silhouetted, I guess, against your retina. So it's black instead of red, so it just looks like...
So you had a hemorrhage?
It looked, yeah, a hemorrhage, and it was really frightening.
So, and you had no inclination, really no awareness that anything was happening until...
None at all. And then just this big blob of ink, I mean, black comes out of it. It's horrible. And it happened a few times. You know, it got some laser. It happened a little bit more. I had it in both eyes. But now I haven't had any well, I've had a little bit of hemorrhaging from the scar tissue tearing, but I haven't had any near vascularization or anything. It's wonderful.
That's been very fortunate.
It's amazing.
Yeah.
Yeah.
So, Dr. Rivers, what happens with the diabetics, and what is it that might predispose them, and how should we take care of people with diabetes and their eyes?
The main problem with diabetes is that even under good control, there can be complications of diabetes in the eye. So that people who do a very good job of controlling their blood sugar have these complications at a much later date, but they still have complications. The very good news with diabetes, however, is that all of the complications from diabetes are treatable. We've had excellent treatments with a laser since the 1970s, which still works very well. And when people have this bleeding in the eye, it's an indication that there is an abnormal blood vessel that's growing inside the eye. Those abnormal blood vessels will rupture because they're so fragile and fill this vitreous cavity with blood. If the blood does not clear, we even have an instrument that allows us to go inside the eye and suck that blood out. That's called a vitrectomy. We remove the vitreous, and by removing the vitreous, we can not only treat the problem with additional laser, but the patient can see right away. And that surgery has been present since the 1980s. So diabetes is a problem. Many people have diabetes. Many more people are having diabetes because of our poor eating habits.
Right.
But fortunately, the complications of diabetes in the eyes are very easy to treat.
So it's interesting. So you're saying that basically the change in the blood vessels that occurs over time with diabetes, and especially with those who aren't well controlled, meaning that their blood sugars vary significantly and they don't keep it under a relatively tight level, that they will then have the opportunity for some of these vessels to bleed in the eye.
That's correct.
Does blood pressure or cardiovascular disease have anything
Yes.
to do with that as well?
There are additional risk factors in that people with blood pressure that's under poor control, that can adversely affect the eyes. People do continue to smoke and have diabetes, which can affect the blood vessels. It's hard to imagine, but it certainly affects the blood vessels. And high cholesterol is a very high risk factor as well. And these all add to the diabetes.
Smoke. There's still, unfortunately, a lot of people who do savor those cigarettes, or even, I guess, pipes and cigars would still have a similar effect. Is it the smoke itself, or is it the chemicals that get into your bloodstream that have that
the
impact?
chemicals themselves. Diabetes is a disease that affects blood vessels and decreases blood flow and decreases oxygen. And any type of smoking further decreases the oxygenation of the tissues.
Right.
And that can be very detrimental. In fact, there are times when these treatments don't work, and people do still go blind from diabetes. And the reason is specifically that the circulation in the retina is so diminished that no oxygen goes into the retina, and the retina can't function correctly. And that ischemia, or lack of oxygen, is something that we cannot fix.
And they do say that the leading cause of new blindness in our country, in the world, is diabetic retinopathy.
It is true.
And blood outside of a blood vessel isn't a very healthy place for it to be.
That's correct.
And that blood in that core, in the vitreous itself,
right.
causes an inflammatory reaction, which is what then creates the whole process that
Right.
you try to prevent.
And even more simply, the blood is in the way. This is a camera system. If
Right.
all of a sudden the camera system has this inky black swirly mess in the way, because the blood is in the vitreous, then people don't see. And in fact, the vitreous is a jello-like substance, and the blood gets stuck in that. And sometimes the blood can stay there for months and months, but by removing that vitreous, by removing that jelly, we can put salt water in the eye and patients can see again.
That's phenomenal. Do they need correction? Does it change the way their lens and other optics work?
It usually does not.
Does not. Okay. So were your eyes Did you require glasses before?
Yes.
Okay.
Yeah, but I did get a vitrectomy.
Yes, you did.
Which is wonderful.
Yes.
It got rid of all the junk. I don't even have floaters,
Yeah,
which I
that's
guess a lot of
fantastic.
people have.
Well, that's
and
great.
in my right eye's completely clear.
Right.
It's really
Okay.
nice.
So if you're talking to other folks with diabetes out there, or, unfortunately, diabetes is one of those conditions that many people who have it, especially the type 2, they can walk around for years with a precondition, a metabolic syndrome, or one of those kinds of things, and have a lot of these changes start to take place. And then all of a sudden they get the real crisis where they become aware of the fact that they need insulin or some other approach to treating their diabetes. But they really need to take care of it. If you were a diabetic at age 12, but it took you into your mid-40s to come to this realization, were you seeing an ophthalmologist along the way?
No,
No.
it wasn't.
So it's a story that you might preach to other people with diabetes,
Well,
or to screen, to have regular checkups. of
well,
your eyes.
sure.
Yeah.
Yeah.
Okay,
Yeah.
I can understand that. That's for sure. We have a dog who's laying on the carpet. That's good. We're hearing about retinitis pigmentosa. We have a number of people here who've told us about that condition. And one has said it started from birth. How about yours?
No, I was about 20 years old.
20 years old. Okay.
When I started driving, I noticed I had a problem. But they just kept saying nobody can see at night. It's astigmatism. I kept finding myself driving on the wrong side of the road. And then a couple years later, I was bumping into, like going through doorways, bumping into corners.
Right.
And I went somewhere else and got checked out just by a friend who worked for an ophthalmologist.
Right.
And she said, you need to get checked out.
So you were 20 and you were already having problems driving at night, which is hard to imagine anyone 20 experiencing without something underlying it, but nothing really jumped out at you. Were there any other symptoms that you had that you felt, now you look back, oh yeah, that might have been something?
No, there was nothing because I never wore glasses and I couldn't read. I had, up until the time I started driving, nothing was apparent.
Okay.
It was at night, the change of light, when the oncoming cars, I couldn't adjust back and focus after the bright lights, and that was causing the problem.
So how about going into dimly lit rooms or?
I didn't
anything like
notice
that?
it then.
Didn't
Now,
notice it,
yeah, I didn't notice it then.
Okay. Any other symptoms that evolved over time that you became more acutely aware of?
Well, then I became diagnosed, and then I developed cataracts and had several cataract surgeries, a lot of complications with the cataract surgeries, lasers, and,
So we've got two great stories here for you. We've got cataracts as well.
Yes.
So at that point when you were 20, did you have, let's say, any of the changes in your vision that would inhibit the way you could see or read or do anything like that?
Not
nature?
at that time.
No.
No, I was shocked.
You were shocked? Yes. Okay.
Completely shocked.
Retinitis pigmentosa, and we're going to hear a little bit more. An interesting disease, an interesting condition. Let me get the cord over here too. Thanks. You have retinitis.
Yes, I do.
Tell us a little bit about your experience with it.
I was looking for a job in 1986 and was having trouble reading the classifieds, so I thought I needed reading glasses. And I went to a local ophthalmologist who, after an exam on a bright snowy day with my eyes dilated, told me I had a degenerative retinal disease and I was probably going to lose my eyesight.
Well, that must have been rather disconcerting.
It was a tough
Bedside
trip home.
manner wasn't the greatest
tough
at
trip
that time,
home.
no. Yeah.
And RP, in essence, causes tunnel vision. It's where you lose your peripheral vision. Night blindness is also a symptom. And after I was diagnosed, then looking back to high school years when we might be on summer vacations and out in the wilderness and I was having trouble seeing the stars, something started to make sense because of the night blindness component, which I didn't realize at the time.
So with the retinitis pigmentosa, the first things that you can remember are those episodes of not being able to really see what other people were seeing
Right,
in,
once I
in
was
dim light,
diagnosed.
in low light. And then we have another one, right?
Yes.
I'd like to hear a little bit about how you became aware, and you said that you were born with it.
Well, retinitis pigmentosa is a genetic disease, and it's passed down through my father's line. So my father, his vision was already failing probably since college. And then when we were born, when my brothers and I were born, we're unusual because our entire, all of us have it. That's very unusual for 100% of the children to have it. So we all have it. And we knew we had it because our father had it, and we were diagnosed fairly early.
Okay, so he didn't have any family members that he was aware of, or let's say they weren't diagnosed and identified, he just discovered this through his visual changes?
Almost all the people on his side of the family have some kind of vision problem.
Right.
Retinitis pigmentosa apparently wasn't diagnosed until his generation. We knew that his father had problems and was going blind, but there was no name for it, and my father was diagnosed with RP.
Okay, and so you knew about it before you actually had symptoms?
Yes.
And how did you take the symptoms as they evolved? I mean, were they symptoms that you knew what to expect and it was like, all right, here it is?
That's one thing about having a family member with it, especially a parent. I can look at my father and I can see what I'm going to be like. So I can tell the way it's going to track, and it pretty much has. Okay. So what's good about that is I can prepare, and I do have some idea, and I'm able to adapt ahead of time.
Okay. And you've had to adapt in a lot of special ways. You have children now?
I don't have children.
You have no children. Dr. Rivers, tell us a little bit about retinitis pigmentosa.
Sure.
That sounds like a pretty fascinating kind of disease because of the tunnel vision. We want to hear a little bit about that too.
Retinitis pigmentosa is a disease of the pigment behind the retina. And the retina itself is nourished by this pigment, so that if there are diseases from this pigment, then the retina itself won't work. There are several problems that can cause pigmentation to fall apart or to not work well. Retinitis pigmentosa is by far the most common reason for this pigment to fall apart. But there are other reasons, such as medications, other pigment diseases that will cause the same type of process. In retinitis pigmentosa, the reason for the night blindness and the reason for the peripheral vision loss is that the rods are selectively involved as well. And the rods are more peripherally located, and the rods are responsible for dim vision. The cones are in the central part of the vision, and the cones are not involved with this disease until much later. There are a couple complications that can occur with retinitis pigmentosa that can be addressed. Unfortunately, the retinitis pigmentosa itself cannot be treated. There are no treatments to repair the pigment in the eye. But as one patient mentioned, the lens in the front of the eye can become cloudy. And that can occur in patients with retinitis pigmentosa. And if a lens becomes cloudy, that's called a cataract. Cataracts are very common. The most common reason for cataracts are age-related. I'm very sorry. But 20-year-olds don't get cataracts. But by the time you get to be 40, you can have cataracts. And this lens gets cloudy and functions as a filter and blocks the light coming into the eye. When this cataract gets so cloudy that it is causing problems, then a surgeon can take a small needle, suck the inside of this lens out, and put a small plastic implant into the space and restore the functioning of the eye. The eye needs these lenses to work as a camera, and there's now a nice clear plastic lens that allows patients to see. The tunnel vision that people describe with retinitis pigmentosa, unfortunately, is very common because the vision is lost from the edge and moves toward the middle. And that's a particularly difficult problem for patients because they don't have peripheral vision. There are certain ways of helping patients like that, And actually, I'd like Dr. Alibi to help me with this because he has many patients with retinitis pigmentosa.
That's true, Dr. Libby, that usually a patient diagnosed with retinitis pigmentosa will see a retina specialist just to get that concrete diagnosis made. And the retina specialist cannot replace the retina, as Dr. Rivers has explained. So we have to move to the next step, which is to rehabilitate this individual. And as the person in the audience pointed out, the symptoms we deal with are night vision issues, mobility issues, and glare issues. A lot of people with retinitis pigmentosa also suffer from glare. Now, I wish I could say that we have glasses that can correct everything, and as a low vision specialist, people come to an optometrist and say, I'm used to getting my glasses, and I hope I can get a pair of glasses I can drive and read and function normally again. And certainly, that's the first step, is to make sure that they're not myopic or have astigmatism and correct that. And if they need glasses for reading, prescribe that too. But the issues like mobility have to be addressed in other ways. Eventually, most patients with retinitis pigmentosa will have to use a white cane and use the cane to guide them in terms of their mobility. And there are many retinitis pigmentosa patients who even use a seeing eye dog to guide them. The night vision issues is not easy to solve either. There have been attempts to make night vision goggles, similar to the military. We see them wearing those infrared goggles, and to some extent they do work, but they're hardly practical, nor are they very cosmetically appealing to any of patients who have retinitis pigmentosa. So these types of strategies are not as good. We usually recommend very basic things like good lighting, using flashlights when they're walking, or just learning sighted guide techniques, how to take somebody's arm and have them guide you and lead you. The glare sensitivity we usually address with special kind of filters, and many retinitis pigmentosa wear yellow and amber filters, and it seems to help. So there's no universal solution, but there are a number of strategies that we work with.
Terry, when you're an occupational therapist, so Dr. Alibi will determine if there are lenses or other kinds of things that can be used to help. But those activities of daily living, they have to turn to you for a lot of assistance with. Now, white cane training, I think that probably people universally associate people with vision problems, and they usually assume that they are totally blind without any semblance of vision at all. But what's the situation with that, first of all? With people who use canes, people who are blind, I mean, what percentage of people are actually totally blind, where they basically have a total blackout?
It's actually very small.
Very small. So
people will usually have something.
They'll have something, right?
And it's amazing how resilient people's spirit is and how they can use that something to function at a certain level.
And you work to do that. Tell us a little bit about the white cane training.
White cane training is actually taught by an orientation and mobility teacher. I am an occupational therapist. My specialty is more related to things, more of activity of daily living, like inside the home, cooking, more of writing checks, doing your bills, reading your mail, going shopping and figuring out how to read the price tags and the labels. When we talk about traveling about and being independent as best we can with mobility, that's best instructed through an orientation and mobility instructor. Those teachers are very skilled, very trained, and go to school to teach people how to use white canes and use other techniques to safely move about in their environment, in their community. And when patients with retinitis pigmentosa and other types of patients like that who come in and work with us, we work at our best to guide them towards the resources like an orientation and mobility teacher. There are orientation and mobility teachers that work through different agencies, such as in Virginia here we have the Department for the Blind and Visually Impaired. And after seeing the ophthalmologist and optometrist, the doctors refer them to the state agencies, and they're connected to these teachers, and these teachers work in very close with them on how to use the white cane, how to get around in their environment, in their homes, in their communities. With occupational therapy, we work more on strategies such as learning how to use residual vision to read again, to cook again, and we deal with issues that are more one-on-one with the patients. Many people who come into our clinic, I sit down and I work with them on, it seems forever, on how to write a check with the residual vision you have. How to be able to read a bill.
It's always hard to write a check in the first place,
True. And after
it's easier when it's online. You don't have to really write it out.
Amazingly, the banks will take it, but there are many non-optical things that that we teach patients
People
with
have to
vision
live.
loss
They have
to
to
use. Yes.
Do you continue to cook?
Absolutely.
Absolutely. Okay.
Absolutely.
So you have a hard time seeing ingredients, no? How do you deal with that? How do you cook when you have a hard time seeing everything in the kitchen?
I live a very interesting and exciting life because I don't always know what's going to happen and how it's going to turn out. But I'm an adventurous soul, and I do get hungry, so I mess around a little bit.
All right.
I live by myself, and I want to maintain as much of the previous lifestyle that I had before. Some things I have to give up, and some things I have to modify, but I just refuse to just sit back. I work with some of the patients. Dr. Alibi sees the patient originally, makes a medical diagnosis. Terry works with them on all the occupational strategies that she mentioned. But neither one of them has an eye disease like I have. And I can say to a patient, or Dr. Alibi says, this is Mary Ann McCarthy. She's 90 years old. She's got macular degeneration. She lives alone. And she does okay, more or less. More or less. And so
I'd say more than less. Yes.
Thank you. We have to give people hope that it's not the end of the world, because when you first learn that you're losing your sight, you're going to go blind, is that the end of life? No. But life changes, and you have to make some adjustments. I wasn't promised a rose garden. Were you? No.
Well, no, but I kept on pretending like I was. Still do, but that's okay.
I can share with them some of my own experiences. And I learned a great deal from a woman I think is in the audience, Gloria Sussman, who was a wonderful, wonderful teacher for me. And I've taken what she has taught me, and I've gone beyond that as much as I can. There are always all kinds of agencies and organizations and private, public, et cetera, out there who are willing to help people who have this impairment. But you have to recognize, first, that you have the problem. Secondly, that you want to do something about it. Then you have to reach out. And when you do, you'll find lots of help. But you can't just sit there and wait for something to happen.
Feel sorry for yourself.
Yeah.
You know? Yeah, well, listen, you have a spice for life, so you must be a good cook at that, that's for sure. Gloria.
I'm here.
Oh, you're Gloria. I'm sorry. Okay. You also have an eye condition.
Yes.
And tell us a little bit about how your symptoms evolved over time.
I was very nearsighted as a child, and as I got older, instead of the eye stabilizing, it got worse. And finally, I had a tear in the retina, in the macula, and I started to not be able to read any longer.
And that then introduced you to Dr. Rivers or someone of his ilk?
Yes, and also to Dr. Alibi.
Okay, good.
Because we have a great resource in Dr. Alibi, and he helps a lot of people to cope, to learn to cope, to realize that there is coping, as Marianne has said. That's exactly what we do.
And I suppose then one of the inspirations you had was, I have this affliction, it's not going to defeat me, and it's not going to defeat other people. I'm going to learn about it, I'm going to find resources for it, and I'm going to help other people.
That's absolutely true. And so I do have several support groups that I help, and I try to help other people. And the Prevention of Blindness Society is one that sends me around to do some of these support groups. And also, we are working with a library. The Fairfax County Library is absolutely a marvel. It helps people like us with talking books and with many, many other things, including computers and talking computers and all that kind of thing.
A lot to learn about. Now, I know with you have tunnel vision.
Correct.
And you've made some interesting adaptations in your lifestyle.
Yes. I find nothing specific. I've used, there are a few things, I guess. I use a MagnaCam, which is something that magnifies things that I want to read on a screen.
Right.
And I use a wireless mouse that has a magnifier on it. I have completed my cane training. And I've just adjusted some of my kitchen strategies, trying to keep things at a certain place in the counter, keep them away from the edges. And other than that, to be quite honest, I do everything that I used to do before, just as determined. I admire Marianne's Spice for Life, but I share the same determination, and sometimes it just takes longer to get things done, but I'm still able to do them.
Can you go to the movies? Can you do things that routinely you had for recreation previously?
At this point, yes. At this point, I may not see the way everybody else does. Things are not as sharp, they're not as detailed. But I can still do everything, absolutely.
Great. Fantastic. Age-related macular degeneration, that's another important one. Mostly because it is something that you can take care of if you realize that's what's going on.
That is absolutely right. The problem in my right eye was diagnosed during a routine annual physical. And Dr. Maurice Gaspar referred me to Retina Group and Dr. Rivers. That was back in May 2004.
Okay. So had you been going for regular ophthalmologic exams over the years?
That is correct.
So it was just something that just showed up. So at some point, and was that in your 50s, mid-50s?
It would have been, yes. And I had no indication that there was a problem.
Right.
The problem with the left eye occurred one beautiful sunny Saturday morning. I was driving down Broad Street in Falls Church. Suddenly I couldn't see. The eye was filled with blood. Everything was fuzzy. Went immediately to see Dr. Rivers and began treatment on that one.
So we have macular degeneration. That's an interesting topic. Could you give us a little background on what that is and what happens?
Certainly, and we have had 3 different types of macular degeneration that we've heard about this evening, and they all share problems in the very center part of the retina. The macula is the center of the retina. It's a location. And when the macula degenerates for different reasons, it causes central visual loss. So unlike retinitis pigmentosa, which strikes the peripheral vision and moves toward the middle, macular degeneration strikes the central vision, usually quite dramatically. Macular degeneration is another disease of the pigment and the retina, where the body, for some unknown reason, grows blood vessels, and these blood vessels are very fragile, they rupture, they cause scar tissue, and up until very recently was the leading cause of blindness in the United States. The macula is an area that is only about 5% of the retina, but because it is so integral to seeing people's faces, driving, reading, a small amount of damage to the macula can have a profound effect on how patients can function.
So what is the age where you might commonly see that begin?
Well, with age-related macular degeneration, I'm sorry, there's that word again.
Yeah.
It just keeps coming up. Patients are usually in their 60s by the time they have symptoms. On the other hand, patients who have myopic macular degeneration, or a macular degeneration from their eye being too long, or histoplasmosis causing these same blood vessels, those patients may be in their teens.
Histoplasmosis, now that is a fascinating diagnosis. You just reminded me that we have a patient here who has had changes in the eye that may be related. Okay. Hey, Pooch, there we go. Good. Okay, we're going to take your tail. That's great. We're going to talk with Smokey. He's got quite a story to tell himself later on. Okay, so histoplasmosis. Now, it's interesting that people wonder what that is. Why don't you tell them?
I was born in Louisville, Kentucky, which is the Ohio River Valley. And what I've been told, what Dr. Rivers has told me, is people who live in the Ohio River Valley are susceptible to this, and it is retinal scarring.
Right.
And, or they're raised around chickens. How that came out, what the difference, I don't know. But I was raised in that area. And never knew it. Now my siblings do not have it. And when I was in my late 20s, I started seeing, having multiple white dots that I would see. And they knew something was wrong with it's my right eye. Right. And in 95, I was diagnosed with histo. 96, I moved to this area, and that's when I started seeing Dr. Rivers.
And since that time?
It's kind of, well, it was okay because I knew what to look for if there was any changes in my vision.
Right.
And about 18 months ago, I started seeing wavy lines when I knew they were straight. And I immediately called Dr. Rivers' office, said there was something going on. And that's when they found out that I had the CNV, which is a choroidal
neovascularization.
That
of course,
one.
Yes.
And I had basically a leaking blood vessel.
Right.
And I was seeing wavy lines.
Now, she's talking about wavy lines. And if I remember correctly, there's a pretty effective screening tool that is available to most people.
There is. We have, and we give them out by the handful. It's a simple piece of graph paper with a dot in the middle, and it's called an Amsler grid, after a Dr. Amsler. Right. And it is a way to have patients give themselves an exam every day. We instruct them to cover each eye individually and to look at this grid. And if they notice a new blank spot because of bleeding, or a new wavy line because there's fluid, that can happen very suddenly, and that's an indication that they need to come see us. All types of macular degeneration have two forms. The first form is the dry type, and that's true whether it's histoplasmosis or age-related or myopic. The dry type of the disease is usually asymptomatic. We can see it when we look in. We can see areas of the pigment and areas of the retina that are scarred, but this does not necessarily affect the vision. But for some unknown reason, at some point, the body decides to heal that area and grows these abnormal blood vessels. And these blood vessels very rapidly will grow, cause damage to the macula, bleed, cause permanent scarring of the macula, and can cause a catastrophic amount of visual loss. The good news is that even in the last 2 years, there have been newer treatments for patients with the wet form of the disease. When these blood vessels start growing, we have a very effective series of treatments where patients receive injections of a medication inside the eye. In some cases, multiple injections, up to 20.
Well,
And
we're going to have to hear from somebody what that experience is like, because I can't say that many of you out there are thinking that it's a great idea. Let's stick a needle in my eye and see if it makes me see better.
Yep.
But you've had a number of those treatments. Tell us a little bit about what they were like. It must have been rather horrifying thinking that you're going to the doctor.
It was a terrible thought,
Yeah.
yes.
I mean, I'm a pediatrician, so giving shots is part of my life too, and
I
they
mean,
scream, but I'm not sure if anybody would accept it from you the same way.
Having a needle stuck in one's eye, that's not a happy thought.
No.
But over the years to date, I've had 24 injections in both eyes altogether. And the consequences have been remarkable. Surprisingly, there was a reversal of the condition. The vision improved each time.
Is it? Well, let me ask you this. People often will avoid doctors because they're afraid something's going to happen that's going to be painful, or that they may not like the outcome from. They may hear what they don't want to hear, stop smoking, or whatever that might be, advice-wise. But a lot of times it's the procedures that keep them away. Did it hurt when you had this done?
No.
No.
It really doesn't.
It really does not
There's
hurt.
some discomfort, but the eye is completely anesthetized.
Right.
I feel a bit of pressure when the needle touches the eyeball. There's a kind of a pop when it penetrates.
Right.
There's a swirl in the vision. The vision becomes obscured for a while, but it clears rapidly. That's about it.
Okay. So you don't, and then afterwards you don't feel.
There might be a bit of an ache way deep in the eyeball for a few minutes.
Okay.
The following day, there might be a feeling as though there were an eyelash caught in the eye, a
Okay.
scratch.
Right. Sure.
But Dr. Rivers provides a eye drop for that.
Good. Good.
Uh,
So things
if-
work out pretty well when that happens, and it's something you would advise anyone.
I'd like to get on my soapbox and say,
Right.
don't be afraid of getting hurt.
Right. Okay.
It is there's some discomfort involved.
Right.
It does not hurt.
Right.
And so far, the consequences have been remarkable.
Right.
If it hadn't been for Dr. Gaspar and Dr. Rivers, I'd be blind today.
Well, you're a hero. You actually are. That's a fantastic thing. Have you had laser or some of the other procedures that?
I've had several lasers in both eyes, and I had a vitrectomy on my left eye.
A vitrectomy. So you started to bleed into the back
No,
there?
with the schisis, it began putting traction on the retina and pulling on the vitreous, and we basically tried to laser it closed, but there was enough of the loose vitreous that it leaked into the schisis, and so I couldn't see anything. I had a big, like, blue line. So they went in and did the vitrectomy there and several lasers on this. But I got motion sick, which I'm going to bring up because it's just a weird thing. With the vitrectomy, we did the gas bubble, which dissipates as you heal. But it's very visual, and it's like watching a sand picture. And it got me seasick.
Did you get seasick easily anyway?
Yeah, I get motion sick.
Okay.
And, but it took us like 3 or 4 days to figure out what that was. And the minute we put the patch back on, it was great. And subsequently, that was pretty much the last treatments that I've had, and I've been stable now for 3 years. So.
And laser itself is not something that you have any trepidation about. It's
I don't
pretty
like
well
it,
tolerated.
but yeah, you got to do it.
Yeah.
So.
So you have more of a sense of something happening with the laser than maybe even the needle.
Yeah, probably, because the white light, it's
Yeah.
very...
It's sort of a very, let's say, a very loud statement at the time.
Yeah, it's very intense.
Okay. And what kind of procedures did you go through with some
With
of
my
yours?
RP?
Yes.
It was, I just would like to inform people in the audience or watching us that my first indication was that I used to drop like a pin or a bobby pin, and I would be down on all fours trying to look for it. Didn't have any idea that there might be some kind of visual problem. My family thought, there's something wrong with the brain up there or something. I'm losing it because I had young children. And then I went to the university to get just a regular eye exam to get my glasses updated, and was told that I have this rare disease. Can all the students look in your eye? And that's when I found...
That's a bad sign.
That's
Yes.
right.
Right.
That's when I found out that I had RP. Now mine is the rods on the outside I have a 5% visual field, which has stayed stable for a while, and the cones in the middle are going, so my central vision is blurry. You're close to me, I can see your eyes, but I couldn't tell you what color they were, anything like that. And I have had the cane training, and I would also like to tell the public to please look out for white canes, and we need an education to the public as to what those mean so that people don't get hit. For example, my Braille teacher, who works for the Department of the Blind, was hit with a dog, a sighted dog, in the crosswalk that he's used many days going to the grocery from his apartment, and this person didn't stop. And it's an interesting story. I mean, I was just alarmed. Yesterday I went into my local optician to get my glasses adjusted, and the young lady said, "Oh, that's a really interesting piece of equipment. What is that all about?"
Really, at the optician?
That's right,
good.
a very young person.
haven't trained her well yet.
So people do not know, and it would be great for the blind community if we could get more education out there about the canes and the dogs.
Right.
Dogs cannot sense cars always. Canes cannot. And we just need to get that out. So I thank you for giving us that opportunity
Well, sure.
tonight.
And I think that, what I hear is that people can see some, but they can't necessarily see the things that get in their way.
Right.
And the cane is extremely important for that. It's not like you're completely sightless and you can't sense the flow of things around you. It's just that you can't see the things that can hit your legs.
Or
bump
cause you to
into
fall.
Or cause you to fall.
For example, I had just retired from teaching and I fell down 13 steps in my house and flipped over, so I'm very lucky to be here and fractured
Yes,
the
you
pelvic.
are. Yeah.
And then at that point I was standing, just going to talk to my husband, which I thought I was at the top of the steps, but obviously I wasn't. And I said to myself, I believe I'm blinder than I thought I was,
Right.
and I need to get cane training and some help. And I got some help from Dr. Alibi and his occupational therapist. But yes, we feel like often that we can see something, but it may not be true. And it gets worse with this disease as we age, or everybody is different with RP.
Right. One thing I don't want to forget about that was very interesting to me, and that's the histoplasmosis infection and vision. I'm not sure if people necessarily think of certain types of infections. I mean, obviously, there are things that can literally attack the surface of your eye that people might be aware of, herpes or even chickenpox virus.
Sure.
But it's a rare thing. But histoplasmosis, now, are we in the histo belt, as they call it?
The histo belt includes the Ohio River Valley, Mississippi River Valley, and pockets in Virginia and Maryland.
Okay.
So we have patients who have never left Virginia and have histoplasmosis. And this is a fungus. Histoplasmosis is found in the soil in these river areas, and in some way it's ingested and is inside the body. And one of the ways that the fungus grows is inside the eye. And when it grows inside the eye without symptoms, it causes these very characteristic little scars. And later on in life, decades later, the body senses these scars and starts to grow these abnormal blood vessels, which is the hallmark of the wet macular degeneration.
And are there other infections that people need to be aware of? So, I mean, that's something that people need to understand exists, and that it's not like, if you wash your hands, you won't get it. If you're in certain settings, in certain climates, I guess, it's something that's
the geographic region
right.
is the main issue.
Well, we also heard from someone that they took a medicine that they were using for another condition.
Yes.
And that there was a side effect, and that
Yes.
was chloroquine, you said.
Right. I have rheumatoid arthritis, and I was unable to use methotrexate, and I was put on a drug called chloroquine, and it's a malaria preventative,
right.
quinine-based, and they found it's sort of like aspirin. It's used for one thing, but they found that it helps prevent strokes. Well, chloroquine, they found, helps prevent the inflammation that is caused by the rheumatoid arthritis. I went on it June 1984, and it was explained to me you can have some blurred vision, there might be some problems, but that was it. Just recently I found out there was a big court case in 1984 in D.C. where a person lost their sight, and it was mandated that the safest dosage is 10 milligrams per day of chloroquine. In June of 1984, I was put on 250 milligrams per day, and I was on it. I started noticing eye changes in 1997, and I was basically told that nothing was wrong for the next 6 years. And I woke up one morning, and my total central vision was gone in my left eye. I was lucky. I understand that most people, correct me, Dr. Rivers, that most people lose their vision in both eyes at the same rate. I was not legally blind in my right eye until January of 2006, so there was a 3-year time when I was able to cope with going blind.
But it was a progression that you couldn't stop. But you know, you made a new friend in the deal.
Yes.
We have Smokey here. Smokey, hey buddy, how are you? Now, I would ask you a question, but I'm not sure that you really want to answer it. But it's a personal question about your mistress here, I guess, your master. You've had Smokey for how long?
2.5 years.
2.5 years, and
And
seeing eye dogs are indispensable.
He's not a seeing eye dog.
He's not a seeing eye dog.
And
okay.
it's
He's a companion.
they're a dog guide.
Right.
He's a service dog.
I see.
And I have some peripheral vision.
Right.
My vision, I try and think of how to say it. It would be like holding a pair of binoculars about 4 inches from your eyes, and where the binoculars are charcoal gray, and I have peripheral vision. There are other consequences of this. I'm losing sense of color. I'm also losing my hearing, which is a side effect. But Smokey came to me just because I wanted a companion.
Right. And he looks like a very, very fine companion at that. Seeing eye dogs, I know we have other things here that we weren't able to really get to. You have a phone, Dr. Alibi. You have, I guess, from your office, you have a lot of these tools, magnifiers, special lights. You even have something that actually magnifies things as you read them. But it's an incredible story. It's an incredible process, and we're lucky that there's a lot of information out there on taking care of the eyes. I know the county has a number of groups, and they provide a lot of services, and certainly people should contact the county if they want to know about vision and vision care and groups that can help them with learning how to cope with what they have to live with. I really appreciate everyone for being here tonight. I appreciate you all for viewing in. And I want you to know that there are important people out here who can help you with any of your visual problems. And you just have to stay on task and make sure you talk to your doctor about it. Anyway, I'm going to wrap it up and say so long. Until the next time, I'm Dr. Russell Libby, looking out for your health. Thank you.